Uh, well, first of all, I'm not short-tempered, but anyhow, if you must, the reason for surgeons being slightly more aggressive, or at times people say short-tempered, is because on an average day, I wake up about 7 in the morning, then I come to work, then I have to go to intensive care unit and do a ward round. Most of my patients can be sick, and some of them can be very sick. I have to speak to their families. I have to reassure them. Sometimes I have to break bad news. So by the time I actually get to theatre, I've already been dealing with some junior doctors who've just joined in, some intensivists, some family members of some really sick patients, and some of the patients actually do die. So you have to deal with their families. So by the time you actually start your day, you've already had an emotion of being ecstatic to being very grieved. Then you come to work, then you have to go to theatre, and then you've got 2 more surgeries to do. Both of them are delicate, both of them are high pressure, both of them are high risk, and you want everything to be just perfect. And not only those families, you just have to remember that I've got another 20 people standing outside that I have to go and speak to following this surgery. So if something goes wrong, something's not according to the standards that I expect every day, I do get upset. If the instrument's not as per my requirement when I'm dealing with the very fine arteries in the heart, I do get upset. And if things are not done in a certain way that ensures patient safety, yes, I do get upset. So people might think that surgeons are short-tempered. After I finish my surgery, I'll barely get a cup of coffee before my secretary's been calling me from the clinic saying there are 10 patients waiting. So I have to go down, speak to those 10 patients. Some of them are in pain, some of them are going to have certain issues. So that is another 10 patients and dealing with clinic. While I'm dealing with clinic, I'll get a call that my second case is ready. So I have to go back upstairs and do the whole thing all over again. Then by the end of the evening, I'll be speaking to 2 families on which I've done surgery. And all those families have their own questions, their concerns, and they want my 100% full attention as I belong to them. And after that, I have to go and do another ward round on my patients in ICU and see all my post-operative patients. But before that, before I finish work, I have to see patients that I'm going to operate on the following day and deal with their families and questions. So by the time I get home, it's going to be 8-9 p.m. and I have to deal with my kids, family, issues with my mom, my dad, my kids, my grown-up teenage daughters. And then by the time I sleep, it's going to be midnight and I'm going to get a phone call at 3 o'clock in the morning, for which I'll wake up. Then I'll get another phone call at 6 o'clock in the morning. Then I'll wake up again and answer the questions of my intensivists, my colleagues in ICU. So by the time I get to work, the whole circle starts again. So yes, there is a bit of a degree of tiredness, there's a degree of being a perfectionist, there's a degree of being slightly obsessive to achieve those standards. So yes, surgeons can at times be slightly short-tempered, but we don't mean it in a bad kind of way. And all we want is our patients to be well and everything to be to the top standards that we deliver here in Shifa.